Hi, welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and I'm here with another wonderful guest. Erik, would you like to introduce yourself?
Yes, hi Jennifer. Thanks so much for having me. I'm Erik Swanson. I'm a senior vice president at a management consulting firm called Kaufman Hall and Associates. And there I lead a data science and analytics team where we are focused on helping our clients, providers, and others solve some of the biggest and hairiest challenges in healthcare using data science and analytics. So it's wonderful to be speaking with you today.
Yes, I am so excited for this conversation because I actually pulled from your February flash report for a couple of podcast episodes ago, looking at the overall health of the healthcare industry, and you had some comments there that really resonated with me. Can you summarize those for me? Do you mind?
Yeah, absolutely. So as part of our work in evaluating the performance of healthcare systems nationwide, it's worth noting that we're beginning to see larger and larger discrepancies between organizations that are doing very well and those who have stagnated to some degree. And as part of our work, one of the areas we wanted to explore was the use and application of artificial intelligence and data science or advanced analytics and solving those. And what we found was when looking at the high performing organizations, they had a different set of characteristics than those who had stagnated relative to these spaces. And it was principally around having really well defined AI and advanced analytics strategies. Contained within those strategies, we found a number of very interesting areas. So, number one is that organizations who are deploying advanced analytics in really meaningful ways are doing so by focusing on the business problems first and then potentially finding AI ways in which to solve them rather than having interesting AI solutions by which they are trying to find a problem. And that is a very common thread we see too often. We are in a period where for many technologies, this included, we might be going through a little bit of a hype cycle. And what we find is that those who are using and looking at all of those solutions first rather than the problems tend to not be focused in the areas that they ultimately need to and are not seeing the type of impact and outcomes that the higher performing organizations certainly do. So, number one, focusing on business problems first. That's the first key point. Second is early wins and the ability to roll this out is very often focused on some of these more mundane tasks. And the way I often describe this is we think about